All right, ladies and gentlemen, thank you for your time and getting through to the end here. My name is Dr. Remy Arnold. I'm a physical therapist. I wanted to thank Michael for that excellent introduction. Before I get my slides up here, I wanted to talk a little bit about my family. We are extremely active people. We love to hike and travel. And because of that, we have tended to exercise most of our lives. But strengthening, specifically getting our muscles strong by lifting, wasn't always a part of that. My mom, my dad, and my brother have all had injuries that they've had to go through. And from that, they've gone through their own journeys to discover strengthening. It might have helped having a son and brother that was a physical therapist. But I reiterate that point because strengthening can seem confusing. It can be behind backgrounds and it can be behind walls. And I want to try to break those walls down a little bit. So what we're going to focus on here is a presentation about finding your own mountain. I want you to go through your own movement journey to discover what it is for you need to do in order to accomplish your specific goals. So without further ado, I'm going to go ahead and share my presentation here. Let's get to the beginning. Finding your mountain. What you can see here is a picture of Denali. On the far right is the tallest mountain in North America. I was lucky to see this and take this picture a few weeks ago from Talkeetna. And of course, finding your mountain, I had to have a picture of one of my favorite mountains on this planet on this slide. Michael already introduced me. My name is Remy Arnold, doctorate from physical therapy from St. Louis University in 2020. And I'm a travel physical therapist. I've had the privilege of living and working in Alaska and Belize and Hawaii, California, and Louisiana. I also have had the privilege of treating people as young as 2 months old, working in pediatrics in Alaska, as well as old as 104 in Hawaii. And what I have found through all of that is that we love to move as humans. And if we can't move, it's hard to sometimes get back to that unless we know how. So this presentation is going to talk about the benefits of that exercise. It's going to talk about a little bit of why it's difficult to exercise in a way that doesn't hurt ourselves, but also that we can do consistently. And then I'm going to break down what we think of as aerobic or cardio versus strengthening with a focus on that strength aspect. So what if I told you that you could take a single pill every day and you could have this list of benefits that you see here? I'm not going to read this entire list to you, but what I want you to notice and look at is that middle one there that says increasing your life and health span. This is a conversation I have a lot with my patients. Your lifespan is the number of years you get on this earth. Your health span is how healthy and able you are to do what you want to do when you want to do it during those years. What I try to do is increase in an individual's health span as much as possible so it can be almost symmetrical with their lifespan. Of course, the reality is that it is far more complicated than those two simple things. But what we can do is a lot in order to get our health span increased as much as possible. Now, this is the part of the advertisement on your TV where they list a litany of terrible sounding side effects. Your brain turns to ice, your feet to marbles, and your hands to rock. But what if I told you there was no side effects with exercise? Maybe getting a little sweaty, maybe getting a little bit sore, but the actual case is that it increases your health span. So let's go more into that. Now, I do want to talk about how large the exercise industry is. It is a multi-billion, $30+ billion a year industry. There are so many people online, on TV, on journals that talk and tell you that you need to do X, Y, and Z. You need to do this exercise, this diet. They point at you, they're fit and attractive and tell you, you need to do what I do and you'll look just like me. Fundamentally speaking, this isn't always true. I want you to find your own mountain, to do what it is you need to do to be where it is you want to eventually be. Now let's talk a little bit more about that. In general, these are the CDC guidelines, the Center for Disease Control and Prevention. Direct from their website, they ask for two things: 150 minutes or 2.5 hours of moderate intensity physical exercise and muscle strengthening activities on 2 or more days of the week that work all major muscle groups. This is weekly exercise. Now, this sounds just important enough that we can do this every week. It seems reasonable, but it's also just vague enough that we don't quite understand what all of this means or how to break it down. We're going to speak about both these sections here. I find the more intuitive, easier to understand version is that 150-minute aspect. That's your cardio, your aerobic activity. What I find people struggle with the most is the strengthening aspect. So the focus we are going to do is on the strengthening, but what we're going to do is start with that moderate intensity exercise. So again, moderate intensity exercise. What does that mean? You can see on the right here, the RPE scale, rate of perceived exertion, is a great way to intuitively break down what this actually means. I want you to pay attention to that green section, subjectively 4 to 6 on your scale. What I like to talk about here is your ability to have a conversation while you're doing this movement and exercise. So that green section saying you're still somewhat comfortable, but it's getting noticeably more challenging. You can only hold a short conversation. You cannot do what I'm doing right now, having a full conversation without it being really challenging. However, we look above, vigorous activity, meaning you can get out maybe a sentence or two, but that's really it. That's when we can tell ourselves this is probably a little too much. And again, for everybody, this is extremely different. For a recent transplant patient, this might mean that getting out of bed is part of this movement. And it also might not 100% pertain to you. But as we progress and get better and stronger, it absolutely will. Likewise, we can't do too light of an activity. If you are able to have this full conversation while you're doing your exercise, you probably aren't doing enough. Now, it might sound obvious to you, you need to get a little bit tired with exercise, but many times I find people don't quite understand what that means. So again, subjective scale. Some people, that means you're running pretty fast. Some people you're walking. It doesn't matter to me what you do. It just needs to be enough activity that having this conversation is tough. Now, the question I always get asked, Remy, what is the best exercise for me to do? The answer is always the one you do most consistently. Are you a runner, a hiker, a swimmer, dance classes, cycle classes, CrossFit, high intensity yoga, whatever it might be? The thing that when I say go outside and get some exercise, that's usually the first thing people think about. That's what I want you to do. Now, another great thing I want to talk about is that, again, those guidelines of 150 minutes doesn't inherently break it down for you. So that's what you need to do. Are you somebody that can do 30 minutes a day for 5 days to get the 150 minutes? Could you want to break it down to 10 minutes 3 times a day during that 5 times a week? Or do you want to go the weekend warrior route where you do an hour on Saturday, an hour and a half on Sunday to get that 2.5-hour range? What's nice about those guidelines is that it doesn't dictate specifically how you do that. So that is up to you. That is up to you to find that mountain and build that into your life based on how you live. So we're going to touch on the way to stay successful for the long term. Those 3 things you see on the left are what I find to be the most important to get exercise into your daily life for the long term. Intentionally setting aside your 10, 20, 30 plus minutes of exercise and building that into your schedule is extremely important. We all live busy lives with children, family members we take care of, taking care of ourselves, busy jobs. There's a million sticks in the fire. And if we do not intentionally set out to do this movement and exercise, I guarantee it won't get done, or it won't be done as well as we need to do it. So really build it into your schedule, whether that's, again, the weekend or during the day, between classes, during lunch, whatever it might be. Write down on your schedule, because if you try to shove it in at the end of the day, I guarantee it won't happen as frequently as you want to. The next aspect is record what you are doing. Humans are fantastic at overestimating how much movement and exercise they're getting. So if you think you're getting 30 minutes and you're going through your routine, you do it quick, the actuality is, without actually breaking down that time, you're probably losing 5 to 10 minutes here or there. Now, if we extrapolate that and look at losing 5 to 10 minutes a few times a week over 52 weeks, all of a sudden we are hours behind where we actually want to be. If you're the kind of person that will really benefit from recording for the long term, please do. Write in a journal, text yourself, whatever it might be you need to do to record. Do that as long as you feel necessary. It also might be true that you do it for 2, 3, 4 weeks and you understand how your routine works better now. And all of a sudden, great, you don't need to record as much, but be honest with yourself. Keep yourself honest. Don't overestimate. Of course, listening to your body is also extremely important. Before, during, and after activity, are you feeling any sharp pain? Are you feeling any shortness of breath? If you're feeling something and you're wondering, is this right? It's probably not, and you need to talk to a clinician. We're going to talk a little bit more about that in depth on a later slide here. In general, the best person to help you with exercise and movement is a physical therapist, as well as a physician. Utilize your clinical team early on if you have questions, because the longer you wait, the more we can get into what I call the negative feedback loop that we'll get into here in a second. Another thing I say all the time in clinic, on your good days, don't overdo it. And on your bad days, do something. So we all wake up feeling great sometimes. It does not mean I want you to go run a marathon straight out of bed, because then you'll be laying in that same bed for the next 7 days straight. Consistency is king. We have got to break that up if we're feeling great. But likewise, we all have days where we are not motivated, where we're not feeling great. And all of a sudden, you're not going to want to do anything. But please, I advise you to do something, some light stretching, a walk around the block. Generally speaking, if we do something, it lifts our spirits, and we then are a little bit more motivated to do more. But keep it within your tolerance. Break up your movement as needed. Again, 150 minutes can happen however it needs to happen for you, your family, in your community. Just get it done and get it done consistently. So that's kind of that intuitive aspect I'm talking about. Generally, this part, that moderate activity level, that amount of time, people can accomplish pretty easily. But like I was mentioning, my family didn't quite understand how to build in that strength training. And eventually, through time, through their own physical therapy journeys, and through the persistence of yours truly, they have developed their ability. So let's talk about strength next, so you too can develop that ability. Over there on the right, you can see Arnold Schwarzenegger, probably the most iconic bodybuilder of all time. While I don't need you to look like this gentleman, and this is that part of the presentation where I say, pay me $200 a week, and within 3 months, you're going to be looking just like this. Absolutely not. Of course, that's not what I'm looking for, but you can basically see every single muscle group that we need to work on here. Again, this quotation is directly from the CDC website. Muscle strengthening activities on 2 or more days a week that work all major muscle groups, your legs, your hips, back, abdomen, chest, shoulders, and arms. I will be including PDFs of these exercises, all these muscle groups. They will be eventually on my LinkedIn post, as well as posted on the Stanford Transplant website later, probably within a week or so of this presentation. Again, in my clinical experience, this is the hardest aspect for people to get right, for people to do well, and then for people to do it well consistently. But it tends to be the most important. So let's get into that. Remy, why do I need to strengthen? Well, honestly, it is the best way in a non-pharmacological, non-invasive way to increase and maintain lean body mass, which is massively correlated with a reduce in all-cause mortality, with a reduce in falls, injuries, and re-injuries. Now you can see in that middle section on the left side, increasing your athletic performance. I have athletic in quotations because I truly believe that everybody is an athlete in their own capacity, whether it's a high school athlete looking to play soccer, or it's a 95-year-old who wants to be super grandma or grandpa and schlep their kids around or go walking with them. Everyone tends to have athletic endeavors. That includes the person that wants to sit straight for 6 hours and knit up a storm. That requires strength. A thing I also like to talk about with my patients and clients is if the activity you love to do right now is challenging and you're expecting yourself to do it in 5 to 10 years, I ask that you reevaluate your expectations. You need to be really good at doing what you love now so that in 20 or 30 years, you can increase your health span and still do those things that you love to do. The hardest part that I find for people is finding that mountain. Why are you working hard? To what end? I have so many patients and clients that come in, usually almost always they're in pain, and I ask them what their goals are. And most often, the biggest thing I hear is, I want to be out of pain. That's fantastic. Of course you want to be out of pain, but why do you want to be out of pain? To what end are we working here? Again, do you want to be out of pain so you can play with your grandchildren or walk with your spouse or go skiing or climbing? Whatever it might be, if you do not have a specific goal, you're not going to work as hard as you should be, as intentionally as you should be towards that goal. That's one of the number one things I work with in the first 20 minutes of a visit with a patient, that evaluation. Why are we here? Besides the pain, what are we working towards? Again, without that specific goal, you're going to be floating around in space without anywhere to go, like our little astronaut friend here. Don't be that astronaut. Get those feet on the ground to find that mountain. Now I'd like to break down what I find, not only do I talk about the most in clinic, but what seems to be the least understood in clinic when I'm in there working with patients. that first part, stability versus mobility, is so important. Generally speaking, those areas of our body that are most mobile tend to be the ones that are most injurious. I'm speaking of the shoulder, I am speaking of the lower back, and I'm speaking of the hip. Again, they are joints that move a ton, 360 degrees of motion. Really a huge part of us as humans is that ability to move that much. But with all that mobility, we have got to keep things strong and stable. If we do not have stability in those areas, we will get hurt in those same areas. Again, that's probably the areas I see most often in clinic with pathologies, with injuries, post-surgery. The shoulder, the low back, and the hip make a lot of my caseload, and probably I would argue a lot of my colleagues' caseloads as well. So we are going to have some specific exercises later. Don't feel like you need to take notes and read every single one. Those PDFs will be included on my LinkedIn post as well as on Stanford's website within the next week or so. They cover every muscle group we talked about. They cover the stabilization muscles that we're going to get into more in a few seconds here. And those are the ones that you need to address. Again, if something doesn't feel right, speak with your clinician, ask your physical therapist or personal trainer if these are right for you. But they cover every muscle group that we need to look at. And we've got to get those working twice a week. Now, probably the most important thing that is in this presentation, that if you only take away one thing I want you to focus on, is working to fatigue within those sets and reps. So what are sets and reps? That is how I, as a doctor of physical therapy, prescribe the magical drug that is exercise. So a lot of these exercises you're going to see are going to say 3 sets of 10. Again, that can sound a little bit generic, but what I need from you is that within every set, you are working until you are tired and fatigued in that muscle group. That doesn't mean you do a set, you're a little bit tired, you do another set, you're a little bit tired, and you do the last set, and then, okay, I feel like I've done some work here. I need those muscles almost failing per set. So that last 9 and 10 repetition are actually challenging. That requires you to take 20 to 30 seconds of break. And then again, we repeat that process. So if we can get to 10 easily, then it's necessary to increase our weight, our resistance, whether it's a band, whether it's a dumbbell, whatever it might be. It's got to be more challenging so that every 10, we are being challenged. So that's what sets and reps are. It's a prescription, truly, of what you need to do. I tend to see this as the biggest thing people get wrong. They think I need to be a little bit tired by the end of that 3rd or 4th set. But the reality is we've got to be tired every single set to really get the benefit we're looking for. If we don't, we're kind of spinning our wheels and not doing what we think we're doing. Focus on that fatigue. Now that next part, pain versus soreness. This is really hard to talk about because pain is a massive body of science and it is so subjective and not perfectly well understood. I do not want you to be ouch, sharp pain while you're moving, after you're moving, or before you start moving. So if you have sharp pain in the muscle, in the joint, if you have weird pains in the chest, stop the exercise, reevaluate your technique. If it continues, immediately seek out clinical support from your physician, from your physical therapist. Your physical therapist is your body movement expert of the medical world. Again, if it feels more medical outside of just your muscles and bones, you've got to go see a physician. But if you can get into a physical therapist for what you feel is just muscle or bone, then do that immediately so that we can break the negative feedback loop. We'll get that into a second. Soreness. I do want you to feel some soreness. Within about 24 to 48 hours after you do your exercise, you should feel some soreness in those muscle groups. If we don't feel any soreness at all, we probably aren't, again, fatiguing ourselves enough. Soreness should feel like oh, I worked this muscle, but it shouldn't debilitate you or make it impossible to use the same muscle the next day. Should feel like a deep inside the muscle soreness. Again, sharp pain is a big no-no. Now, I mentioned that negative feedback loop before. What I mean by this is when a body part hurts, when a muscle hurts, we start to move it less. It's the natural response of the body. When we move it less, it gets weaker. When it gets weaker and we try to return to activity, return to the same thing we usually do, we will get hurt or injure ourselves or increase that pain, and our cycle starts to go down. We hurt, we move less, we get weaker. We hurt, we move less, we get weaker. Our job is to break that cycle. We need to move more to get stronger within pain tolerable ranges in order to get back to what we want to do. Again, that negative feedback loop is what I see most often in the clinic in terms of somebody that didn't have a trauma or at least a recent trauma comes in to see me. They come to see me 1, 2, 3 years after this, and all of a sudden that negative feedback loop has gotten into a cycle that you need to see a clinician for. So the earlier you deal with that, the better off you're going to be. These next few slides, once again, are going to be those specific exercises I was mentioning. I'm going to be doing some demonstrations here, and you're going to see some similarities with some of these exercises. I'm going to focus on 2 exercises for the shoulder and 2 exercises for the hip. The ones I see done most incorrectly, the ones I see done the least in the gym, and or if they're done in the gym, probably in a way that makes people get injured. I see people doing these movements, and I'm about ready to start handing out business cards because I feel like I'll be seeing them in clinic later down the line. All jokes aside, let's break down some of these exercises so they make a little bit more sense. They will once again be posted. Don't feel like you need to take notes, but let's get into it. On this first one here, there's 4 exercises for the upper body. These are all covering front, back of arm, chest, and the back. But what I want to look at with you is the ones you see starred here, the internal and external rotation exercises. So I'm going to stop the share here, and we are going to get me all the way up on the screen. So let's talk a little bit about those rotator cuff exercises. What I need from you is a band or resistance that is coming directly away from your arm. So what I want is your elbow kissed against your side. One of my great tricks I always do, get a towel, put it between your elbow and your ribs so that you have to pinch that at all times. We are going to first do internal rotation. This is for grabbing, holding, carrying. Anytime you're bringing something towards your body, we're using that internal rotation exercise, movement. It tends to be stronger than the opposite, which we'll get here in a second. I want you to think about keeping your shoulder back, not forward. Keep that shoulder back. And if this is neutral with my hand, my elbow, and my shoulder all in line, I want you moving from 45 degrees to 45 degrees on the other side. So neutral, 45, neutral, 45. That total arc of motion, that total arc of rotation is 90 degrees. So what I want from you, you're going to do 10 repetitions, and oof, all of a sudden I'm tired and I need a rest break. Then I do another 10, etc. The biggest thing I see that gets done wrong here is without this towel, all of a sudden the elbow starts to come off. I create this gap between my elbow and my ribs, and that is not rotation. That is compensation with other muscle groups we're not focusing on. With that towel, that forced pinch, we stay in true rotation, and we can actually hit the 2 muscles that do this rotation, okay? Internal rotation, very important. The other one we're going to look at is external rotation. You can think of external rotation as anytime you're coming overhead and pushing, anytime you are throwing anything, whether you are a baseball player or just playing toss or throwing rocks just for fun, that is external rotation. It tends to be a weaker muscle group inherently just because of the way it is in terms of going overhead is just a weaker motion than coming into your body. So that means you may need a little bit less weight and or you may need a little bit less band resistance. It's the same concept though. Starting hand, elbow, shoulder, all in line. I've got my trusty towel tucked so I can pinch tight on my ribs. Neutral, once again, 45 degrees to 45 degrees. It's a more challenging motion, so I've done less weight here, so I can get to fatigue still in 10 without overdoing. If repetitions 6, 7, and 8 are impossible, then you need to reduce the weight a little bit. Getting to fatigue in that 9 to 10 range is truly what we're looking for physiologically. So those are the 2 rotation stabilizing motions for the shoulder. What I'm going to do is once again share my screen here so we can go look at the 2 lower body exercises. These will be printed for you so you can take a look. Again, these 2 are going to cover our glutes and hamstrings, as well as squats to hit our quadriceps. Again, you can look at my star here. You're going to be looking at a clamshell exercise, an all-time favorite of most physical therapists. If you've ever been to PT for anything in the legs, I guarantee you've done it before, as well as the straight-legged version, which is actually working on a different muscle. So let's delve a little bit more into that. For this, I want to be getting on the floor. So again, let me stop sharing, and you can see what we'll be doing down here. You're going to see some similarities here because it's a lot of rotation. Again, these joints have a ton of mobility, which means the stabilizers would actually get to that mobility through rotation of what we're focusing on. With that clamshell, you're going to be laying on your side. My knees are about 90 degrees. My ankles right in line with my hip here. The big thing I see people do wrong is they rotate backwards towards the wall behind me too much. I really need you to be stacked with those hips, even feeling like you're rotating a little bit forward. And all we're doing is once again going through rotation. So I'm opening my knee to about 45-degree angle once again through my femur. And this is targeting your glute medius on the side of your glutes here, okay? This is super important for walking, hiking, and stairs. It keeps our pelvis level and stabilized as we're moving. To add resistance, you put bands over both legs and around the knees, just above the knee, in order to get to that fatigue. More bands required if you can do 10 easily. Of course, start with nothing, see how that feels, and go from there. You should feel this muscle working between the front and back pocket is what I usually say. The next one, which is a little bit more challenging, is called sideline hip abduction. We are now going to have the leg straight but slightly angled back. So if I turn towards you, again, that leg is straight and slightly tilted back. And now I'm coming straight up and down, once again, to about a 45-degree angle. To make this more challenging, you can add ankle weights. Again, you can use a band. It's a little more challenging with a band. I might suggest the ankle weight. And we're going to do another 3 rounds of 10. Of course, the big thing is over rotation. So if I'm here and I rotate, I'm basically just doing a quadricep or a hip flexor exercise. We want the hip abductors, your glute med and min, doing the work. This is how we're going to stabilize and lock in our pelvis. It's great for runners. It's really good for anybody who walks. So if you're a person who walks, I suggest fatiguing these muscles well so that you don't have to see me or any other physical therapist in the clinic for pain. So those are those exercises that I think are most important, that are done most incorrectly most often. Let me reshare my screen here for the last time. Another couple of exercises here, focusing on your core. Another, of course, extremely important area to really work and strengthen is those abdominal muscles. The crunches, the isometrics, and the press are all to cover the 4 different kinds of muscles we have in our abdominals. Again, check in with your personal trainer, make sure, or your physical therapist or your physician, make sure they're right for you and feel good. Get to fatigue. That is number 1, okay? I want to thank you for your time. I am so privileged to be a part of this cardiovascular transplant symposium. And I want to reiterate that everyone is on their own journey. Everyone has their own movement background. That's one of the hardest things about exercise is we all come from different places. And when we look for information about how to do this well, we get told a lot of generic things. All these exercises cover the basis and the fundamentals and can and should be modified based on your personal needs. So if you're 2 weeks out of transplant or 3 years down the road, it's going to be a little bit different for you. Check in with your clinicians, check in with your clinical team, check in with your doctors, make sure it's all good for you. Now, the biggest thing, of course, that I'm asking of you is to go find your mountain. Please, I implore you, get your goal, find what it is you're working for. And once you find that, make a plan, an attack so that you can get and increase your health span to do what you want for as long as you want, when you want, with the people that you love. You see a picture here of Hatcher Pass. It is one of the more beautiful places I've seen in Alaska. These are my literal mountains. This is why I work hard in the gym to strengthen myself so I can go into these places safely, but most importantly, come back safely. As one of my favorite mountaineering sayings goes, getting to the top of the mountain is optional, coming back is not. Again, you can see my LinkedIn at the bottom there. If you'd like to visit that to see this full presentation, it will be there as well as with those exercises. Likewise, you can visit Stanford's transplant website for the entire symposium, including this talk, as well as those PDFs. Thank you so much for your time. I'm privileged to be here with recipients and family alike, as well as the other fellow speakers. I couldn't be happier to be here with you today. Go find that mountain, go get sweaty, go work hard. Thank you very much and have a great day.